Hi, my name is Angelica Franco and I'm the security supervisor here at McKee Medical Center. I'm here today to talk to you about security and some of the safety that we have at McKee. A little history about me is I've been here for a little over a year. Before that, I transferred from NCMC in Greeley and I was a security supervisor there and worked there for a little over 11 years. So I have a lot of information to share with you. I appreciate you coming here today and listening to me speak. I hope all the information I have for you is helpful. So first of all, security is available 24 hours a day, 7 days a week. We have a minimum of 2 security officers here on staff. A couple different ways to get a hold of security. Number 1 is dialing 6118. That's our non-emergency number. A couple things that we can help you with when dialing this number is if you go outside and have a dead battery, maybe your tire's flat, maybe it snowed outside and you need some help cleaning off your vehicle. Give us a call. We'd be more than happy to go out there and help you. If you come in early in the morning or you leave late at night and you'd like an escort, feel free to give us a call and we'll go out there and help you out. Also, for all emergencies that I'm going to cover today, 55 is our emergency number. From any in-house hospital phone, you could dial 55 and let them know what type of assistance you need. The first code I'm going to cover is Code Red. Code Red stands for fire here at McKee. So if you happen to run into a situation where there's a fire, dial 55 and let them know you need assistance. I'm going to share a couple of different acronyms with you today. The first acronym I'm going to share with you is RACE. It's very important to remember what this stands for a couple different reasons. Helps you remember what steps you have to take in case of a fire, and it also helps you when facilities does their monthly testing. There's a chance that they'll ask you questions and it's important that you can answer them for them. The R in RACE stands for respond or rescue. Depending on what area you're working in, you may be asked by medical staff to help evacuate patients to a safe area. The A stands for activate or alarm. There's 2 different ways that you can alert somebody that there's a fire in your area. The first one is a fire pull station. We have fire pull stations located everywhere in the hospital on the wall. Once you pull that station, it'll notify the fire panel that there's a fire in your area. The second way to announce it is by dialing 55 and letting the operator know that there's a fire. Let them know the location so they know where to dispatch security in the fire department. C stands for confine or contain. So depending on what area you're in, you may be asked by staff to help close doors to keep the fire out of the patient area. The E stands for extinguish or evacuate. So usually when we talk to people about extinguishing a fire, we talk about a trash can size fire for a couple different reasons. Number 1 is your safety. If the fire is too big, we don't want you to put yourself in danger. Number 2 is you don't know what caused the fire. So you don't know how quickly the fire is going to spread. So if you feel safe to do so, put the fire out. The second acronym I'm going to go over is PASS. And that just helps you remember what steps to take when using a fire extinguisher. The P in PASS stands for pull the pin. There's a little metal pin that you need to pull in order for the fire extinguisher to work. The A in PASS stands for aim. You're going to aim the nozzle at the base of the fire. The first S stands for squeeze. You're going to squeeze the handle. If the handle won't squeeze, then you haven't pulled the pin out completely. So go back and make sure you pulled it out all the way. The second S stands for sweep. So with the nozzle aimed at the base of the fire, you're going to sweep from side to side. The next code I'm going to go over is Code Orange. Code Orange is a hazardous material spill. Usually when I talk to the volunteers, I like to talk to them about this being a hospital and us dealing with a lot of chemicals here. But also when I think about a Code Orange and hazardous material, I think about blood, urine, feces. So if you run into a situation where there's a blood spill or somebody vomited, it might be easy for you to just want to put some gloves on and clean it up really quickly. I highly recommend you do not do that. Our EVS staff, which is housekeeping, is highly trained on how to deal with situations like that. So even if you want to just put some gloves on and take care of it really quick, call them and let them take care of it. If you run into a situation where there's a chemical spill or you don't know exactly what's there, keep the area blocked off until we can get help to the area. The next code I'm going to go over is Code Blue. Code Blue stands for a cardiac arrest or a medical emergency. If you work in the direct area of a code blue, you may be asked to help with family and take them to an area until the physician or nurse can go and talk to them. You will see security respond to a code blue because we will assist with crowd control. If you do not work in the area where the code blue is called, please stay clear from the area. If you happen to be walking down the hallway when it's announced, step to the side because there's going to be a lot of staff members trying to get to the patient's room quickly so they can try and take care of them. The next code I'm going to go over is code triage. Code triage stands for internal or external disaster. Of course, when you think of an external disaster, you could think of maybe a tornado or a flood. But different internal disasters that we can run into here at our facility, maybe a fire at our facility, it could be a bomb at our facility, it could be something as simple as our power going out. A code triage can cause a delay in the treatment of our patients, and it could also cause a huge surge of patients to come into our facility. So during a code triage, you may be asked to respond to different units to help with patients, maybe reuniting family members with their patients, getting extra towels, blankets, food, water to help out with staff. The next code I'm going to go over is code pink. Code pink is a possible child or infant abduction. During this, every staff member in the hospital will respond to assist. Your responsibility during a code pink is to cover all entrances, stairwells, and exits and start screening people. Now, when I talk about screening people, you actually have to check people's bags, look for baggy clothing, and ask them questions. Now, when you first approach somebody and ask them to look inside their bag, they're probably going to look at you kind of funny and wonder why you want to look in their stuff. It is okay to tell them that we have a missing infant. At that point in time, any person in their right mind is going to feel free to let you look inside their clothing, maybe inside their bags. If you run into somebody who's giving you some type of pushback, you may have run into the abductor. If that happens, we never want you to put your hands on the person. And there's a couple different reasons for this. Number one is your safety. We do not want you to get hurt in any situation whatsoever. Number two is the safety of the infant. There's a huge possibility that that person could drop the baby or throw the baby, knowing that you want the baby. So never put your hands on the person. If the person happens to make it outside, get a description of the vehicle and a license plate number and maybe the direction they headed. Give that information to security so we could share that with law enforcement. The next code I'm going to go over is code yellow. Code yellow is a bomb threat. If you're working in an area and you receive a phone call of a bomb threat, keep the caller on the phone as long as possible. Do not hang up the phone. You want to listen for different noises, background noises. Maybe the person has a specific accent. Maybe the voice sounds familiar, but stay on the phone with them as long as possible. If there's somebody nearby, write them a note and say you have a caller on the phone that's making a bomb threat and ask them to dial 55. If there's not anybody around, stay on the phone with the caller as long as possible, and then after you're done, dial 55 and let them know the information that you have. The next code I'm going to cover is code purple. Code purple is overcapacity, and that pretty much means that we don't have any more room for patients upstairs in our facility. In situations like this, usually they're tied into a code triage. So we have a huge surge of patients coming into the facility and we just have no more room for them. If that happens, our patients may be stationed in the wellness center where they may ask you to go and help and get water, food, and as I mentioned before, you may be asked to reunite family members with patients that are in the wellness center. The next code I'm going to cover is code gray. Code gray is broken down into two different levels. We have a code gray level 1 and a code gray level 2. Code gray level 1 is a combative person. This could be a patient, it could be a visitor, it could even be an employee. When you hear a code gray level 1 announced overhead, stay clear from the area. We do ask other staff members in surrounding areas to respond to assist us with the situation. With us working in a hospital, it's a high stress area. So what we ask as security is if you run into family who are starting to bicker, maybe arguing, call security at the 6118 number and give us a chance to get there and de-escalate the situation before it gets physical. If it gets physical or you feel like any second it can change, dial 55 and let them know you have a code gray level 1. Now, code gray level 2 is somebody with a deadly weapon. And of course, first of all, when you think about a deadly weapon, you're probably going to think about a gun. Next, you're probably going to think about a knife. But in reality, any person can use anything that they can find at home, here at the hospital, or off the street. What matters is what their intentions are or how you feel about the situation. If you feel that somebody is going to cause or trying to cause deadly harm to you, dial 55 and let them know you have a code gray level 2. Also, when you hear the code gray level 2 announced overhead, I want you to take cover. I also talk to our volunteers about evacuating the facility. When I talk to somebody about evacuating the facility, I tell them that you're standing right in front of an exit. If you're not standing right in front of an exit, you need to take cover behind a door that you can lock and stay there until you hear the all clear announced overhead. Even if you're there for an hour, maybe 2 hours, you want to stay safe. You do not want to run into a situation where you leave the office and you're starting to walk down the hall and now you put yourself in danger. So wait until you hear the all clear announced overhead. I also like to talk to our volunteers. We do have a lot of people around here that have concealed carry permits. If you see somebody walk in through the entrance and they have a holstered weapon, you do not necessarily have to dial 55 and ask for a code gray level 2. If it appears that they are just here to visit somebody, you can call security, let us know what direction they're headed, and we'll go make contact with them and let them know that they need to take their weapon off of our facility. The next thing I'm going to cover is department emergency instructions. Each department has their own department emergency instructions, which are normally in a red folder mounted on the wall. What these are is each department has information and specific steps for their department on how to respond to every code that I just covered. So if you happen to work in a certain area all the time, get familiar with your department emergency instructions and also take the time to study them so you know what steps you need to take in case of an emergency. Material safety data sheets will help you when dealing with certain chemicals in your area. You being volunteers, you may not run into situations where you deal with chemicals that might cause irritation to your eyes, maybe your skin. But if you do run into something, maybe you get something in your eyes or in your mouth, you can go to the material safety data sheets. There's 2 different places where you can find information. Each department has a yellow binder that has all the information about the chemicals that they work with and carry in their department. It'll let you know what precautions you need to take when using these chemicals. It'll also let you know what steps you need to take in case you do get some type of irritation from them. Another place where you can find information on the material safety data sheets is on the main intranet page. There's an actual link on the right-hand side that you could click on and type in the chemical, and it'll let you know what you need to do. Accident reporting or incident reporting. If you have an accident while you're here volunteering, contact Melissa or Janice immediately to let them know what happened. McKee Medical Center and Banner Health are all smoke-free facilities. So with that being said, if we have visitors or patients that are smoking outside, we ask all staff and volunteers to help security in passing that information on to them. Usually what I do when I approach somebody is I walk up to them and I say, "Excuse me, sir or ma'am, I didn't know if you realize, but Banner Health and McKee Medical Center are smoke-free facilities. So if you're going to smoke, I'm going to have to ask you to step off property." And what I mean by off property is they actually have to go to the sidewalk if they want to smoke a cigarette. What also includes in the tobacco policy is cigars, chew, and even those fancy little vapor cigars that they have now. So we don't allow people to walk through our facility with those vapor cigars. Another part of the policy is if employees and volunteers come to work smelling like smoke, their employer has the right to send them home until they could come back smelling smoke-free. If it continues to be an issue, then it can lead up to termination, and we do not want that to happen. If you happen to run into somebody who's giving you pushback or continues to be a problem and continue to smoke in certain areas that they're not supposed to, contact security and we will go make contact with them and enforce the policy. I want to thank you so much for giving me the time to meet with you and speak with you. If you have any questions, feel free to stop by the security office. Any one of my security officers would be more than happy to help you out in any situation. We appreciate all the help you give us and are so glad to have you here at McKee. Thank you.